The title of this presentation is The Problems of Aging in America. America lags the rest of the world in caring for its old. Healthcare costs older people more proportionately. 1 in 8 American seniors have chronic health conditions. Older Americans are sicker than their counterparts in the other 10 wealthiest countries of the world, averaging 3 chronic health conditions. Seniors in the U.S. also report having more financial barriers to health care than their counterparts in other countries. Researchers find the day-to-day increases of soot led to a 1.5% increase in deaths of people over 65, and increases in smog accounted for a 0.5% increase. This equals more deaths per year by pollution than from AIDS. 1 in 10 people aged 65 and older, that's 10% of the population, has Alzheimer's dementia. Someone in the United States develops Alzheimer's every 66 seconds. 1 in 3 people end up with Alzheimer's or other dementia. The odds of having diabetes are almost as bad. Almost 2/3 of Americans with Alzheimer's are women. African Americans are about 2 times as likely to have Alzheimer's or other dementia as whites. Hispanics 1.5 times. People over 50 have more dental problems. Nearly 1 in 5 Americans older than 65 do not have a single real tooth left in their mouths. 28% of Americans 50 to 64 lack dental coverage. More than half of people over 50 are worried about how they will get dental coverage when they turn 65. People agree dental care is important to prevent dental problems when I am older. Older people have large medical expenses, and health insurance for those ages 50 to 64 is going up, with premiums rising $1,500 in 2019 alone. Social Security recipients will be getting a 2% cost of living adjustment, or COLA, in 2018, the largest increase since 2012. 5.5% is the expected average annual inflation rate for medical care, while Social Security rises only about 2.6% over time. So this increase won't be enough to keep pace with rising costs of living for older voters who depend on the monthly benefit as their prime source of retirement income. A 65-year-old couple retiring this year will need $275,000 to cover health care costs throughout retirement. This is up 70% since 2002. Healthcare costs older people more proportionately. Only 18% of U.S. workers feel very confident about their ability to retire comfortably. 1 out of 6 Americans receive Medicare. Medicare covers 56.8 million people, including 47.8 million people ages 65 and older. Medicaid covers 70 million Americans. What Medicare won't cover? It's not unusual for people on Medicare to spend more than $5,000 a year of their own cash to cover ongoing health care and insurance costs. Medicare and Medicaid policies do not cover dental care, such as routine checkups, or expensive items such as dentures or root canals, podiatry, routine eye exams, glasses or contact lenses, routine hearing tests or hearing aids, elective cosmetic surgery, extended care in nursing homes, or medical costs incurred outside the U.S., where some people retire to live more cheaply. Neither Medicaid nor Medicare is required to cover dental procedures for adults, so coverage varies by state. Some Medicare Advantage plans offer dental coverage, which generally caps benefits at $1,500 yearly. There's a 20-year gap between counties with the lowest and highest life expectancies. Where you live makes a difference in how long you live. 15,600 nursing homes receive either Medicare or Medicaid. Approximately 1.4 million of America's most frail citizens live in these homes. In 2015, Medicaid was the primary payer for roughly 62% of residents. Some patients get Medicare coverage in their first months at a facility. More people and governments are seeking to enable seniors to age in place. Whether living their lives at home or institutionalized, the financial needs for their care continue to grow as more people live longer, but not necessarily healthier. Receiving a pension on retirement. The idea that companies should set aside money for retirees caught on in the mid-20th century. The first ones were offered by American Express back when it was a stagecoach delivery service. That was in 1875. Under union pressure in the middle of the last century, many companies adopted pension plans. Then corporate America changed. Boards gave CEOs lavish salaries. Union memberships waned. Americans lived longer, making a pension much more expensive to provide. Even as late as the early 1990s, about 60% of all full-time workers at medium and large companies had pension plans. Today, only about 24% of workers at mid-size and large companies have pension plans, and that number will continue to fall as older workers leave the workforce. In place of pensions, companies and investment advisors urge employees to open retirement accounts. The basic idea is that workers will manage their own retirement funds. The trouble with expecting workers to save on their own is that almost half of U.S. families have no such retirement account, according to the Fed's 2016 survey of consumer finances. 1 in 3 Americans have nothing saved for retirement. Older Americans over 60 now owe 22.5% of household debt, an increase up from 12.6% in 2003. According to one pension advocacy organization, nearly 1 million people in retired Americans are covered by pension plans at the risk of collapse. This would have lots of consequences both for their families and the total economy. Everyone ages. Don't we need to secure our futures by caring for today's senior citizens? This video is part of a series entitled Healthcare for All. Other videos in this series include difficulties in getting prescription drugs filled in the United States, from chuckholes to sinkholes, hurtful gaps in Americans' health, Healthcare for All, the unraveling of the American dream, health effects of social media, what you lose in the 2017 tax bill. My name is Paul Edwards. My website is localmarketing.center and email homeplus99@gmail.com. My phone number is 661-242-2624. In closing, keep in mind that to reach people we must work smarter than in past years. I hope these ideas enable you to talk with consumers and voters more effectively.